Once again, this is Lita Downs from the Office of Teaching and Learning Excellence, and I am your moderator today for Audrey Blake's session, Exploring African American Women's Lived Experiences with Obstetrics Gynecology Services in Atlanta, Georgia, and Columbia, South Carolina. On the line today, we have Audrey Blake, who is in the PhD Health Services program here at Walden University. Her chair, Dr. Kim Sanders, is also invited. Not sure if she's in the room at this point. At this point, I'm going to turn things over to Audrey. It's so great to have you on the line and to learn more about your study.
Well, thank you for allowing me to do this presentation. As we said, I'm going to be talking about African American women's lived experiences. I want to start out by saying this is my dissertation proposal. So it's actually not a completed study at this time, but I'm looking forward to completing the study. I would like to give you just a little bit about background about what brought me to the point of choosing this topic for dissertation study. There is a measure known as maternal mortality, which measures the rate of death among women, particularly after giving birth. Typically, it's from the postpartum period that goes up to 42 days after birth. There are a few instances of places where they measure this a year after birth. And what we have found, what the studies have shown, is in the United States, the maternal mortality rate among non-Hispanic, Black, or African-American women is 55.3%. Now that is 2.9 times, or almost 3 times higher than the rate for all other ethnic groups in the United States. And when we look at the states of Georgia and South Carolina, which I will be studying, these two states are among the highest, or within the 10 top highest states with the highest maternal mortality rates in the country. I currently actually live in Atlanta, Georgia, and I've spent at least 14 years living in Columbia, South Carolina, which is where I'm from. So you can imagine that this data and information is very near and dear to me and important. So taking that into account, let's look at our problem statement. The problem statement here shows that African American women receiving OBGYN services in Atlanta, Georgia, and Columbia, South Carolina, they regularly experience adverse outcomes such as complications during the preconception period, prenatal period, and postpartum periods. And therefore, this becomes very important to look at the why. When we talk about this, we can see there's truly a proven disparity in the rates when we look at African American women. And however, there have been some studies that have looked at this in other states and other parts of the world, but the reasons are still not fully known as to why is this happening. Specifically, studies have not really looked at Columbia, South Carolina, and Atlanta, Georgia. So let's take a look at the purpose of the study. Next slide, please. So the purpose of this study, which is a qualitative study, is to explore the lived experiences of African American women in Atlanta, Georgia, and Columbia, South Carolina, as they present for OBGYN services. And again, we're looking at 3 periods: the preconception period, which is before they ever get pregnant, the perinatal period during pregnancy, and the postpartum period. So all of these will be explored. This study will highlight and provide some insight on the lived experiences of African American women, and this will go across socioeconomic strata. There have been some studies. For instance, there are programs known as Healthy Start programs that have been funded by the U.S. Department of Health and Human Services that looks at prenatal care and postpartum care for African American women. However, the focus is primarily on African American women receiving Medicaid or in a low socioeconomic income level. the difference with this study is this study will look across socioeconomic levels. So we will be looking at middle-class women, women in poverty level and below the poverty level as well, to look at the full range of African-American women. And I'll talk about that a little bit more when I talk about the potential participants' inclusion and exclusion criteria. So when we think about this is very significant. So let's talk about the significance of this. The data and findings that will come from the study have great potential. It will have the potential to contribute to positive social change. Data collected from the study may inform OBGYN practices and result in additional or updated guidance to obstetricians and gynecologists. Right now, what we are seeing is a subset of children in the United States among African-American, in the African-American community, who are growing up without their mothers. And this is as a result of maternal deaths. The Hulu series currently has a documentary called Aftershock. And this documentary actually traces the lives of two fathers who are now single parents because the mothers died. They did not live in South Carolina or Atlanta or Georgia, but they were in the United States having this experience. This also, as far as the social change, this has an impact on society. There's a strain on the family and the community, and it has an economic impact. And so future generations can experience positive social change as a result, possibly, of the data that we obtained from the study and helping the practice OBGYN services to improve practice and hopefully improve on the outcomes, maternal outcomes. Now, this research question, and I just want to make sure I'm keeping up where I am. So there are two questions that will be attempted to be answered in this study. One is, what are the lived experiences of African-American women in Atlanta, Georgia, and Columbia, South Carolina, receiving obstetrics and gynecological services during the preconception, perinatal period, and the postpartum period? Just literally, what are their experiences? The second question to be answered are, what are African-American women's lived experiences of OBGYN responses to their presenting concerns during visits in Atlanta, Georgia, and Columbia, South Carolina? So these are the two things that we will be looking at, or that I will be looking at during the study. I do want to also mention, and I'll talk about this a little bit during relevant scholarship, but here in Atlanta, Georgia, we have the Morehouse School of Medicine, and they have a center for maternal health equity. So I will be doing some collaborating with this entity, with the center in this study. Okay. As far as the theory and the framework, so there are two theories that will make up the theoretical framework for the study. And that is implicit bias theory, which is coined by Greenwald and Krieger, and also systemic racism theory by Joe Fagan. These are two theories. And I'll tell you a little bit briefly about that. What we find currently is there are standard medical practices that marginalize minority groups, such as African-American women. And examples of that, studies have shown by the dismissive attitudes, also poor communication between the provider and the patient. And this could go in different ways. So hopefully this study will reveal more details about that. When we talk about systemic racism, as I said, this was formulated by Joe Fagan, and he presents this as a theory of oppression, where there are, here in the United States, there's a system of policies and institutions that have been built to keep subordinates in a lower position. And then you have implicit bias theory, and also there's an implicit bias association test that Greenwald and Associates developed. And these are unconscious attitudes and beliefs about individuals based on race. So it's found sometimes that physicians may have an unconscious bias when dealing with African American patients and African American women. By the way, Greenwald and Associates, they also are the group that developed the unequal treatment document, which came out several years ago. And this was a document that showed, it did an experiment, basically having individuals with the same presenting problem present to a physician, and they only differed by race. Their problems were the same, and their income levels were the same, and their insurance were the same. So the only thing that was different was race. And the study showed that they were treated differently based on race. So the adverse outcomes and complications during the preconception period, perinatal and postpartum periods among African American women in Georgia and South Carolina will be explored within this context of systemic racism and implicit bias. So the two will intersect, and it will help to provide some context to their experiences. We can move on to the next slide, please. When we talk about relevant scholarship, I just want to give you a little bit of background about the researcher, myself. Currently, I do work part-time as a maternal and child health consultant with the Morehouse School of Medicine, which is a historically Black college and university. And they have at the Center for Maternal Health Equity. I'm currently a doctoral student here at Walden and in the health services program. I also have completed the Maternal and Child Health Public Health Leadership Institute, where I was a fellow at the University of North Carolina, Chapel Hill. And of course, my master's degree, I have an MPH in healthcare administration. And I've done quite a bit of work for public health departments and healthcare systems and federally qualified health centers. Morehouse School of Medicine definitely will be a major resource with this study, particularly because their Center for Maternal Health Equity has a great interest in working with the community, and they're in touch with the community through some of their NIH grants and working with community implementation projects. Also in Columbia, South Carolina, I don't have this on the slide, but Prisma Health, which is South Carolina's largest healthcare system, and they have quite a few hospitals in Columbia, South Carolina, as well as OBGYN practices. They also will be a resource that I will collaborate with in obtaining study participants. Next slide, please. So when we talk about the prospective participants for this study, here you see the inclusion criteria. They need to identify as African American, women, of course. They should be living in the Atlanta, Georgia, or Columbia, South Carolina metropolitan areas. And I do want to emphasize, we're talking about the metropolitan areas because they can live outside of the city limits of these cities, but this general metropolitan area, many suburbs and communities around that area, because you find that these residents will come into the city to get their treatment and services. They must be between the ages of 18 and 45. They, again, must have received or currently receive OBGYN services in Georgia or South Carolina, in those areas. And there are going to be three groups. I'm not going to divide them, but there are three groups that are eligible. Those that have delivered a live birth in the past 12 months, so postpartum, those who are currently pregnant, and also those who plan to get pregnant in the future. As far as income levels, this is what is going to be different, I believe, about this study, is that it will not be, as I said earlier, limited to individuals on Medicaid. These will be individuals with health insurance, private health insurance, the Affordable Care Act health insurance, or Obamacare as it's now called. All of them will be eligible regardless of their income levels. And as far as education levels, at least a high school graduate or GED and higher will be participants. And I want to emphasize one of the reasons I wanted to make sure we did 18, because that also I won't run into some of those special permission with parents that you sometimes run into according to some state laws. To talk about inclusion a little bit on this slide, who will not be included if a woman does not identify as African American, of course, if they're outside of those age ranges. Also, even if they're living in the Columbia, South Carolina, or Atlanta, Georgia metropolitan area, but they receive care somehow outside of the area, then they would be excluded. They would not be included. South Carolina and Georgia, known for military bases, so they do have a relatively significant military population, but for this study purposes, that population will be excluded because the military, as some of you may know, has a different healthcare system. They have the Veterans Healthcare System and TRICARE system, which in some cases can be very well coordinated, in others maybe not, but just to not, I guess, complicate the study, that population will be excluded from the study. Next slide, please. So here are the proposed procedures in conducting the study. I talked a little bit about who the participants, the potential participants will be. So recruitment, which I've heard sometimes can be a challenge in studies. I'm going to utilize multiple methods of resources for recruitment. I mentioned already the Morehouse School of Medicine, Center for Maternal Health Equity, and their contacts. So I will put the word out with them. Prisma Health in South Carolina, that's another way. And also the Healthy Starts in both states, in Georgia and South Carolina, to put the word out to their participants as well. Social media will be another avenue, excuse me, that will be utilized. And when I talk about social media, that will include LinkedIn, Facebook, Instagram, and Clubhouse. So actually, I may establish a room in Clubhouse to just talk about maternal and child health, and then use that also as a recruitment source for the study. Screening, again, there will be screening surveys developed so that when people do indicate their interest, of course, we will make sure, we will screen to make sure they, I will screen to make sure they meet the inclusion criteria. And informed consent, make sure that they are given the informed consent. And of course, that will go through IRB approved. When I look at data collection, there are two major ways that data will be collected. And one will be through photo voice. I recently found out, maybe in the last couple of years, about photo voice. And I personally love taking pictures. And so photo voice will allow the participants to use their cell phones, smartphones, tablets, iPads, to take a few pictures that represent their lived experiences. And so as a result of that, to ensure or promote consistency in the process, I will hold a photo voice orientation for those participants. And these participants will be a subset of the participants who say, sure, yes, I'd be interested in taking some pictures to represent my lived experience and submitting them for the study as data. Also, focus groups will be conducted. I've already done several focus groups outside of this, not related to this. So I do have some experience in focus groups, and I enjoy that piece. So virtual focus groups in light of COVID, and there may be some instances where I conduct face-to-face focus groups and also do those key informant interviews. And the last part of this, of course, is doing the data analysis and then writing up the findings for my dissertation. So that is the process that I'm looking forward to. And I believe this concludes. Next slide, please. Thank you. These are some of the references that I spoke about, and this concludes the study proposal. I do want to say one thing, because I started to share my screen, but I just didn't feel like it might go well. So there is a film clip on a show called Grey's Anatomy, and there is a scene where a mother had to have emergency surgery and emergency hysterectomy, an African-American woman. And she ended up delivering a healthy baby, but had a hysterectomy. And the partner was there, and he was asking, you know, about the fact that he didn't realize she was in so much pain. And at this time, she was still unconscious, and they were talking at her bedside. And he says, you know, why didn't she come to me? Why didn't she tell me? And the nurse was explaining to him that in our country, sometimes women in general are just not given that permission to express how they are feeling and to ask for help. And so she encouraged him, sometimes you just have to help. And I thought that that clip really spoke profoundly to this study's purpose, is to allow African-American women to express their voices about their lived experiences. This concludes my proposal.
Fantastic information, Audrey. Does anyone have any questions that you'd like to ask Audrey? You can come off of mute, or you can type them in the chat. I'll have to say, from a moderator perspective, your passion for this is so apparent. And I think that's the main fuel behind some of these proposals. And I can't wait to read your study once you're finished with it. And I hope you circle back and definitely present on your findings.
Yes, I would love to do that. And also because this is, you know, new to me as far as doing a dissertation, anyone that can offer any insight, please feel free to do so, or email me, Audrey.blake2@Walden U. So I'm looking forward to it.
I'm going to put your email in the chat, Audrey.blake2@Walden. My dog's even cheering you on in the background. Round of applause. Do you envision any challenges? That's a great question.
Oh, that's a wonderful question. I think there are a couple of challenges. One, I do believe that recruitment will be a bit of a challenge, could be, particularly because I found that several studies, you know, offer stipends and money. And there are places in both cities that you do have individuals who, you know, could use extra income. So being that I'm not affiliated with a grant, I think that may present some challenges. But there also, I do believe that there are people out there that really want to tell their story. So hopefully that will help mitigate some of those challenges. Also, just the fact that as these women share their stories, it can present some trauma for them. And so as a researcher, I really want to be mindful of trying to minimize the traumatic experiences, and perhaps even have resources, referral resources for them, mental health resources.
That's great. Coming from a mental health background myself, I think that's so important that you're thinking ahead and foreseeing that.
Yeah, and I do want to share, because the passion you hear is, I did give birth to a child. I'm blessed now. I have 2 grown sons that are doing well, but I did give birth to, my first child was a premature infant who weighed 1 pound and 10 ounces, and unfortunately never left the NICU. She died at 2 months. And so I think that drives me as well, being a part of the healthcare system and knowing what it felt like. And so there is that drive to help others and find out more about their experiences in a way that will inform the healthcare system and health services to deliver the best possible services to patients.
Well, thank you for sharing that, Audrey. I'm definitely now understanding even more your passion and motivation behind this.
I'd like to thank everybody for attending and your support, and I do look forward to the rest of the symposium.
Wonderful. Well, thank you, Audrey. And thank you for those who carved out time to attend Audrey's session. If you missed any part of it, the recording will be made available on the site. Also, there are several other sessions coming up next hour. So please check back to the website. And I hope you all have a wonderful day. And thank you, Audrey, and best of luck with your future studies. Thank you.
And thanks for moderating.